All right, good morning everyone. We might get underway. There's still a few people wandering in, but I don't have anything particularly important to say, so it doesn't matter if they miss too much of what I'm going to talk about. So my name's Jason Roberts. I'm from the University of Queensland and Royal Brisbane Women's Hospital, and it's a pleasure on behalf of CRE Reduce, which is a NHMRC-funded Centre of Research Excellence, to bring this workshop to you today, this seminar. Very grateful to the sponsors which have also been able to make this happen and ensure that we've got a truly national speaker group and as well as an excellent international speaker as well. And we'll talk about how exciting it is to have Mark here a little bit later on. So the idea for this specific seminar's come largely from all the uncertainties that I've observed as part of clinical practice. So I'm a pharmacist by training, and if there's one thing that I hear in infectious diseases circles is about all of the variation in practice that there is in use of antimicrobials in the community. And of recent times there's been a lot of activity in other countries in terms of trying to provide treatment guidelines to influence the way that certain antimicrobials are used in the community. And certainly from the US as well as the UK, there's been some very important recent guidelines which have some important differences, I think, and I think they're very much worth discussing. From an Australian perspective, I've heard of lots of different practices that occur as well, and I'm sure a lot of these issues will be discussed in a lot of detail later on. Meropenem use in the community is one which has really interested me a lot, and hearing different practices about how some groups will use it as a continuous 24-hour infusion. Other groups are aware of stability issues with it, and so they'll give a higher dose into their infuser, such that by the end of the 24-hour period that there is that overage of drug present, such that they're still receiving the target amount of drug over the course of the day. Some really interesting, they may be safe practices which are being used, but I think that because there is that diversity of practice, it's really important for us to all come together and have a talk about what some of those different practices are, and maybe in due course we can look to try and homogenise some practice and make it as evidence-based and effective as possible. So I think that there's a really good opportunity here for us, and we're very grateful to have the input of many of the speakers in particular who have contributed to this program in terms of the design of it, and of course the talks that they're going to put forth as well. So I will again thank the sponsors who have made this possible. So MSD, we're very grateful for your sponsorship, which has allowed us to keep this this seminar at a very affordable level for all of the people that are here from locally in Sydney and in New South Wales, but also many people that have travelled from interstate as well. This indicates where many of the people have come from. You can see here that we've got a really good coverage across all of Australia and New Zealand as well. We have a guest from Indonesia as well as one from the UK as well. We have about 112 people that are likely to attend through the course of the day, and you can see that most of them are pharmacy, about 45%, with a really good contribution of medical and nursing, as well as some people from other groups including therapeutic guidelines and departments of health. So you all would have seen what the program is. We've got a very good program, I think, which covers a lot of broad issues in and around the area of outpatient antimicrobial, parenteral antimicrobial therapy in hospital and the home, considerations for optimising treatment for patients